My name is Madison Wong. I just finished my junior year at Mills High School, and this is my second year with Project Poll. This year, my interest group is communications, and I am the minutes taker for Team Check-In.
My name is Karen Kwong. I go to Ruth Asawa School of the Arts High School, and this is my first year at Project Pool. My career interest is environmental science, and I am a summarizer.
I'm Ryan Steinbach, and I go to the Urban School of San Francisco. This is my first year at Project Pool, and my interest group was engineering. I was the group's video editor.
Hey, my name is Oliver. I just graduated from SI. I'm going to UCLA next year. This is my second summer at Project Poll. I'm the summarizer for the group, and this year I'm in the environmental science pathway.
My name is Leon, and I go to Lowell High School. This is my first year working with Project Poll, and my career pathway is in environmental science. I am also the director of this group. While the recent outbreak of COVID-19 has certainly affected all citizens of San Francisco, one group has faced particular difficulties. The already vulnerable homeless population has faced a plethora of new obstacles and risks brought on by the pandemic. For one, the inability to shelter in place due to the scarcity and inconsistency of shelter available to the homeless puts them at a constant risk of exposure to the virus. Because the population is generally under-equipped and unable to seek healthcare, this can be a deadly reality. Furthermore, housing struggles have been amplified both by the economic difficulty the pandemic has caused and reduced the space in shelters, which have had to reduce the capacity out of health insurance. This danger threatens not only the homeless, but the city as a whole, because many homeless individuals do not have the resources to isolate. They are in contact with greater numbers of people on a daily basis, allowing for the infection to spread more rapidly, exacerbating the toll of the virus. We support the city's plan to lease hotel rooms to shelter the homeless individuals who are unable to shelter in place.
We interviewed representatives from 3 shelters in San Francisco, as well as from the Department of Homelessness and Supportive Housing. The strife that the novel coronavirus has put on San Francisco's homeless residents is all too clear.
COVID-19 has impacted everyone, everywhere. And I think, particularly, people who have been hardest hit are particularly vulnerable populations. And people experiencing homelessness certainly fall into that category.
This vulnerability is multifaceted. For one, homeless individuals are at a greater medical risk than those who are housed.
There's some indication that, the biological age of people experiencing homelessness is higher than their age on paper. There's some research out of UCSF actually where, X amount of time on the street actually advances, your quote unquote age as far as your body's immune system and response to adverse health impacts. So you'll ask someone experiencing homelessness, are you over 65? And they'll say no. And, that can be taken into account in the quote unquote normal way if they were a housed person, but there are just other implications of that for the unhoused community.
People without homes are 3 to 4 times more likely to die prematurely than the general population. Not only are homeless residents at a greater medical risk, but COVID-19 has exacerbated many of the issues that the homeless residents already face.
39% of young people in our housing programs have lost their jobs or have had their hours reduced. I think a lot of people are going through that. Job placements have decreased by 80% between March and May.
We've seen the city move to some extent to source options for those that do not have shelter. But a lot of what we're seeing is due to health and safety reasons, even more people are now living in tents or just sleeping in sleeping bags or with blankets on the sidewalk due to the reaction of shelters, which have become much more stringent with their intake processes. But the sad reality of that fact is that more folks that would be utilizing our already overcapacity shelter system are now having no recourse except to live in the most dire straits outside on the sidewalk.
There has been a 71% increase in tents throughout the city, with a 256% increase in the Tenderloin. This is partially because the shelters in San Francisco have been forced to reduce capacity by 76% to meet social distancing guidelines. The Raphael House was one of the shelters that had to consolidate in this way.
So at this point, we're trying to figure out how to accept new families into shelter. It's definitely slowed down the process of how we accept clients to coming into our shelter. We're just doing the best we can with what we have to work with. It would be great for things to go back to normal and for us to accept more clients, but we have to protect the people that are living in shelter already, and so we're just being very, very strict with our guidelines. But I know as of last week we've been talking about how we can start accepting new clients and what that protocol might look like.
Before the pandemic, roughly 3,700 homeless people were living in shelters, and at least 5,000 were living on the streets. The reduction of shelter space, as well as the economic impacts of COVID-19, have led to a greatly increased need for shelter throughout the city.
So we've definitely seen an uptick in need for our services. And we've been seeing lots of folks coming to our doors and accessing our services that we've never seen before.
The city has taken numerous measures to help combat these new dangers.
Yeah, I think there have been a number of very effective approaches that happened very quickly to meet the needs of the community, both residents, unhoused and unsheltered residents of San Francisco. And so one solution that I think you can point to with some significant success is the shelter-in-place hotels.
This program, created by an ordinance of the Board of Supervisors, has leased around 2,700 hotel rooms to provide desperately needed refuge for many of the city's homeless residents, with around 1,800 currently in use.
Being able to provide isolation and safety for people who are the most vulnerable, have perhaps been exposed to COVID-19 or even tested positive for COVID-19, and to be able to funnel folks according to their status along those lines into safe environments to recover or quarantine, for a period of time has been a very successful way to address some of the circumstances that have arisen around COVID-19.
St. Anthony's, which purchased rooms for some of the residents whose seasonal shelters expired, found this method to be highly effective.
I think it is a viable option. That's why we pursued it. Bottom line is, when we were closing our seasonal shelter, it was just, bottom line, we're not going to put our elders out on the street in these conditions. It is distressing under any circumstances, but with the coronavirus being a factor, we chose to pursue that, and we would advocate that that's an option pursued by the city for sure, and pursued to a greater extent than they already are.
This plan is not without its concerns, though. For one, many worry about the program's high cost.
One of the biggest difficulties or challenges is, number one, the cost, and even more so, providing the services. That increases the cost significantly, and frankly, the city just doesn't have the resources, not just economic, but in personnel, to supervise and provide services to all the people that you would want to be able to put into hotels.
The plan, pursued to its full extent, would cost the city an estimated $58.6 million a month. The Federal Emergency Management Agency is expected to cover 75% of the cost of qualifying rooms. In order to qualify, the rooms must be designated to homeless aged 65 and older.
So it's the most humane response to the crisis, is the best way to keep them safe and keep them sheltered in a comfortable environment. But I think the logistical hurdles are just too huge for the city.
Although the plan may be costly, it provides life-saving benefits. In order to protect our citizens, it is imperative that the city reduces the number of people exposed to the virus, something this plan does effectively. Currently, however, the safety this plan offers is only granted to a small portion of San Francisco's homeless community.
My sense is that not enough has happened. That the idea of getting people off the street and into the hotel rooms, I was very supportive of. And I don't think that many people have had that transition.
Beyond these logistical concerns, some note that this plan is not a solution to the underlying homelessness crisis our city is facing.
We actually think it's a great plan, and it's kind of necessary during this time. But we also think that there needs to be a plan to move people into permanent housing solutions and not back out on the street when this is over.
This does not mean, however, that this measure is unimportant.
I really want to see people get off the street, and I'm willing to do something that's a short-term effort if it's a path to longer term.
To protect our citizens, both homeless and not from the virus, we need to provide the homeless a clean place to live where they can improve their health and maintain social distancing. After careful research and several interviews, Team Check-in supports the proposed plan to use vacant hotel rooms to house the homeless in order to aid those who are at high risk to the virus. At the moment, access to hotel rooms is still extremely limited. As of May 3rd, the city has only provided around 2,700 hotel rooms for the homeless, which creates a competitive market for them in which infected people are prioritized. We support the plan to lease a total of 8,250 hotel and motel rooms to quarantine high-risk and infected homeless citizens. As of 2019, there were an estimated 8,011 homeless people in the city, and although the number has gone up since the pandemic, with this plan, the city will be able to shelter most of the homeless in San Francisco, preventing the spread of COVID-19 amongst the homeless population and the general population as a byproduct. Although achieving this would require a large amount of resources, they are not unavailable to the city. 11,000 hotel rooms have already been offered to the city, and Mayor Breed can use her emergency powers to commandeer more. In addition, there is a surplus of laid-off hotel workers who could provide the much-needed personnel for this plan. To ensure the safety and well-being of San Francisco's homeless, we strongly support the use of hotels to provide shelter and encourage the city to do so as well.